This film will inform and educate you about the procedure of administering anesthesia, as well as the associated risks. The anesthetist will speak with you before your procedure to answer any questions you may have. Anesthesia requires preparation. You may be given medication to help you relax and prepare for the anesthesia. The anesthetic and medication are administered by inserting a cannula into a vein in your hand or arm. For your safety, your vital functions will be monitored using various sophisticated devices before, during, and after the administration of the anesthetic. Before you lose consciousness, you will be given oxygen through a mask. The anesthesia is administered by injecting a fast-acting, sleep-inducing and pain-relieving agent via the cannula. You will then fall into a relaxed sleep shortly thereafter. With the use of modern devices and medication, we ensure that you remain in a deep sleep-like state for the duration of your procedure. An anesthetist will remain with you throughout the procedure to ensure that you do not experience any pain and that your vitals function normally for the duration of the anesthesia. To make breathing easier and to protect your lungs, a flexible breathing tube will be inserted through your mouth. In many cases, tracheal intubation is used. Intubation refers to the careful insertion of a breathing tube into the windpipe through the mouth. You will be asleep throughout this insertion procedure. In exceptional cases, the breathing tube may be inserted through the nose. In some cases, a laryngeal mask, also known as an LMA, may be used instead of intubation. Like the breathing tube, the LMA is only applied once you're asleep. The most appropriate procedure will be selected for you by the medical team. You will, however, not notice any difference. After the procedure, the delivery of anesthesia is stopped. The breathing tube or laryngeal mask is removed as soon as you are able to breathe sufficiently on your own. You will then wake slowly from a deep sleep. After your procedure, you will be taken to the recovery room where you will be further monitored and cared for. In the case of more complex procedures, it may be necessary to stay at the observation station for a longer period of time. If you experience any pain or nausea, please let us know, as these complaints can be treated immediately. You will be transferred to the ward once you are fully awake and your vital functions are stable. Today, the risks associated with general anesthesia are extremely low. Modern anesthesiological methods and monitoring ensure maximum patient safety. They also apply to major procedures, elderly patients, and patients with pre-existing conditions. Minor issues that may arise as a result of general anesthesia include nausea, vomiting and shivering, tooth damage, skin and tissue damage from the operating table, hoarseness, difficulty in swallowing, and a sore throat. In rare, more extreme cases, the following may occur: cardiac arrest due to acute oxygen deficiency, severe allergic reactions with cramping and shock, life-threatening allergic reactions to anesthetics, severe lung damage due to the intrusion of gastric juices, nerve damage with temporary or permanent paralysis, or chronic pain. During a personal consultation with your doctor, you'll be informed of your individual risk profile. You can help to ensure that your anesthesia is carried out safely by following the recommended steps. Please observe the following rules unless specifically instructed otherwise. You may eat a small meal up to 6 hours before your anesthesia and drink clear liquids up to 2 hours before anesthesia. The liquid may not contain fat, solids, carbonation, or alcohol. Drinks such as water, coffee, and tea are permitted. Avoid milk, cream, and fruit juices. Find out more from us or from your general practitioner which of your medications you should take before the procedure. Please bring the medication with you to the hospital. Before your consultation with the anesthetist, you will be asked to complete a questionnaire about your health. Please be as accurate and honest as possible. You will have an opportunity to ask questions in your talk with the anesthetist before you sign the consent form. Thank you for your attention. We wish you all the best for your upcoming procedure.